The Snyder Center was developed to be able to practice evidence-based, patient-centered, team-directed approaches to the care of the patient with atrial fibrillation.
The research is an integral part of the Snyder Center. With the knowledge that we actually find in those studies, we bring back to the patients and we improve the treatment strategies to achieve highest success. We are proud to offer our patients possibilities to enter 2 of the 4 front trials that exist to date in atrial fibrillation, one being a MACE trial in which our specialists actually help designing and running this trial. Technique that we often use in our patients is long-term monitoring using an implantable loop recorder. This will give us the opportunity to follow up our results for the ablations. With the results that we find, we apply them for patient treatment. As a recognition of our high-quality treatments provided to our patients, we have received the recognition from Intersocietal Accreditation Commission. We are one of the few labs in the country that have achieved this accreditation.
The patient-centered approach is partly what makes us so unique, and it's the very center of our care for the Snyder Center. We've identified different triggers such as obesity, sleep apnea, and stress for these patients and offer resources with which to help them deal with each of these triggers. The other side to patient-centered care is inviting their families along with them to help them learn and to help give them that support system.
We generated the Snyder Center as a way to help educate our patients to understand what all the different treatment options are so that they can understand why A may be better than B, and if they wanted B still, what the advantages or disadvantages of that approach were, and then ultimately respecting whatever they wanted to try to deliver that care in the best way possible for us. And our village consists of pulmonologists, sleep medicine doctors, doctors who are experienced at imaging of the heart, nutritionists, surgeons, stress reduction specialists, and behavior cardiologists.
Recently, there's been more and more evidence suggesting a link between sleep apnea and atrial fibrillation. And we have a pretty clear understanding now that untreated sleep apnea likely promotes atrial fibrillation. So at the Snyder Center, when we're treating someone's sleep apnea, we want to offer all the tools in our armamentarium to properly treat the sleep apnea. Sometimes that means using the more conventional methods such as CPAP or oral appliance, but we also offer the cutting-edge treatments.
If the patient loses 10 to 20% of their body weight, it helps to reduce the occurrences of the atrial fibrillation. So we do have one-on-one counseling with nutritionists. There are group classes that we can send patients to. We do offer cooking classes as well under the Snyder Center, and now we have Weight Watchers.
One of the treatment modalities for treating atrial fibrillation is to manage somebody's weight, which can be done in a number of ways, one of which is surgery. By offering surgery, we can help change a patient's body response to food per se, and that helps people not only lose the weight but maintain that success long term. There's certainly other modalities that we employ as well here at Valley for treating obesity, including medications and alternative treatment options.
The field of behavioral cardiology has a litany of literature describing anxiety, depression, how that activates the central nervous system. So we have a way of meeting with patients, improving their level of education so that they're comfortable with medications, terminology, options. And so the behavioral cardiologist has a role in getting these people back to living their lives, and it's a quality of life issue.
We use social media to get our word out there and invite patients to participate in our behavioral cardiology, in our yoga, in our nutrition resources. And then we're also using a lot of technology in that we have patients purchase cardio monitors, which provides a direct communication with us so that we can keep patients out of the hospital and out living their lives.
The first time I had experienced the AFib, my cardiologist, who's also a Valley doctor, suggested that I go see Dr. Mittal at what is now the Snyder Center. The first time I saw Dr. Mittal, he immediately suggested that I was a good candidate for a cardiac ablation. I was having very severe bouts of AFib that weren't clearing up, so medication was no longer enough. So we did the ablation, Here at the Snyder Center, it's treated as a whole. So I've also had nutrition information. I attend a monthly seminar to learn more about the condition and why it needs to be treated. So the whole experience has worked really well for me. It's been so comprehensive, having somebody to talk to each month about things that may come up and all the frustrations. It's very good knowing that I have the doctor right here and that it's only a phone call away, and they give me the knowledge I need to really understand what's going on. And that's very reassuring, because the more information you have, the better you can help yourself.
Under the umbrella of the Snyder Center, we feel that we're delivering a level of care with respect to atrial fibrillation in a manner that is unique and not being offered elsewhere in this country.